One of the most commonly diagnosed cancers for men and women is colon cancer. And like other cancers, early detection and treatment is key to survival. But a new study on colonoscopies is giving some people pause. Bridget Ellison is standing by now to ask a doctor.
Ask a Doctor is sponsored by Conviva Primary Care for Seniors.
So that study published last month in the New England Journal of Medicine is suggesting the benefits of colonoscopies when it comes to cancer screening may have been overestimated. So what does that really mean? Dr. Robert Hawes, an advanced endoscopist with Orlando Health, joins us this morning. Thanks for stopping by. I know you're busy. What does this study really mean?
So the study was a population-based study done out of Europe involving several countries. The groups were divided into those that got colonoscopy or were invited to get colonoscopy and those that got no screening. And the overall results showed only a modest benefit to those people who were in the colonoscopy group.
Okay. And what do we need to do? Like, do we need to try different methods? What are some of the other methods besides colonoscopy that are recommended to, screen for this type of cancer?
So there are a number of approved screening methods for colon cancer. They divide basically into two groups. One group looks at your stool. So it's a stool study looking for materials that are shed from a colon cancer. The other one is colonoscopy. Both categories are approved for screening for colon cancer.
Okay, and so what are some of the reasons someone would really want to be screened?
Yeah, so it's really important for the listeners to understand that screening for colon cancer is effective in reducing the incidence of colon cancer and reducing deaths from colon cancer. I think that is a primary message that the audience should get.
And this is a fourth leading cause of cancer death, right?
Yes, if you categorize both men and women, it's the fourth leading cause of cancer, but it's actually, if you categorize both men and women, it's the second leading cause of cancer death.
Mm-hmm. And is there, anything that we can do besides some of those hereditary risk factors that you recommend to patients?
So this is another key, and the reason for the importance of screening is this is primarily a genetic issue. So probably in the end we will learn that there's something about our diet, something about lifestyle that has some effect, but fundamentally it's genetics. And so the only way that you can affect the incidence is to get screened.
All right, and so how might we find out, other than someone in our family being diagnosed, how might we find out if we have those markers, those genetic markers that, predispose us?
So it's on a global basis, it's basically your family history. So we divide people into those who are at average risk, and those are the people that we're talking about today who should undergo screening beginning at the age of 45, as was mentioned. There are high-risk groups, and you should actually probably ask your doctor if you are in a high-risk group to make that determination.
Yes, and I know people who often, they get their annual one, just like they would get their annual, other exams and physicals. Yeah. And many times, polyps and different things like that come up out of those.
So that's a point that I want to emphasize. The study that was presented was a little bit skewed because only a minority of the patients that were assigned to get colonoscopy actually got the colonoscopy. And if you look at that subgroup of people who actually got the colonoscopy in the study presented, they had a significant reduction in the detection of colon cancer and deaths from colon cancer. So the advantage for colonoscopy is that, yes, it is very good at detecting cancer, but it's also very good at detecting polyps, which are the precursors to cancer. So when you undergo a colonoscopy, if they find polyps, they can be removed. And that strategy of looking for polyps, removing polyps before they become a cancer has been shown to be very effective at reducing the incidence of colon cancer and deaths from colon cancer.
Well, before we go, can you quickly say anything to encourage anyone to go ahead and get that exam? Because sometimes there's fear, behind getting in to get these important preventative exams.
Yeah, It's for me. It's easy because I see colon polyps and colon cancer every single day. I think the point maybe to take home is that it's common. This is not something that's very, very uncommon. So people think, well, I'm not going to get
And
it.
it's not painful.
It's not painful. That's true. So there's no symptoms that you will get with colon polyps or even with early colon cancer.
The prep is the hardest part.
The prep is the hardest part. No question.
All right, thank you, doctor.